So today's topic is melasma. Melasma is a skin condition that causes patches and spots on the face which are darker than your natural skin tone. Most people get it on their cheeks, chin, nose bridge, forehead and above the upper lip. It sometimes affects your arms, neck and back also. In fact, melasma can affect any part of your skin that is exposed to sunlight. That's why most people with melasma notice that their symptoms worsen during the summer months. Melasma is a very common skin disorder and the condition is much more common in females than men. According to the American Research or Dermatology, 90% of the people who develop melasma are females and it's also called colasma when it occurs in pregnancy. Basically, it's not an infection, it's not contagious, meaning it does not spread from one person to another. It is not due to an allergy and certainly not an pre-malignant condition. Melasma is more common in people of the color and those who tan very quickly but can occur to anyone. It may occur in any population but it is more common in Asian, Middle Eastern, Mediterranean, African and Brazilian populations. So let's understand what is the reason behind melasma. This is a cross section of the skin which shows skin cells arranged in different layers. Among these skin cells, you can clearly see a large pigment producing cell that is known as melanocyte. These melanocytes have finger-like projections known as dendrites which extend all over the skin so that the pigment produced can be evenly distributed to the skin. Melasma develops due to the overproduction of melanin by these cells due to certain factors like excess sunlight exposure. The melanocytes become hyperactive and start producing excessive melanin. This causes the development of the dark patches of the skin on your face or anywhere else on the body. Genetic predisposition, exposure to sunlight including ultraviolet rays, skin type, hormonal factors including pregnancy. Hormonal therapies and the use of oral contraceptives are the main risk for the triggers of melasma. Additional factors associated with development of melasma also include some cosmetic usage, intake of the certain medications like photosynthesizing or anti-epileptic drugs can cause melasma. Certain studies have shown that melasma can be associated with zinc deficiency and an abnormal thyroid function. Change in skin color is the only symptom of melasma. The brown patches don't hurt, itch, or physically affect you. The patches are usually an even brown to gray brown in color and usually symmetrical. There are some patterns in which melasma occurs. Common facial patterns of distribution for melasma include centrofacial pattern, the malar pattern, and the mandibular pattern. The centrofacial pattern commonly affects the central part of the face, including the forehead, cheeks, nose, upper lip, and the chin area. Then we have the malar pattern, which predominantly involves the lateral cheek areas. We have also the mandibular pattern, which affects the lower jawline. So, according to few studies, melasma was associated with depression, embarrassment, and have a negative impact on relationships with other people. The psychological problems can impact young and old patients alike. But the studies point out that the quality of the life was worse in unmarried female patients with melasma. Melasma is generally diagnosed based on clinical presentation or using a special lamp known as Wood's lamp that uses UV rays for a closer examination of the skin. The management of the melasma is often challenging with incomplete responses in many cases and frequent relapses. Patients must adopt to a consistent treatment regime to avoid relapses. Patient education and counseling about avoidance of the triggers and risk factors for melasma and importance of strict sun protection during and after treatment is the key to successful management of the melasma. Most important things you can do to prevent melasma worsening is by protecting yourself from UV radiations. This means avoiding the sun, wearing white brimmed hat when you are outside, and wearing a broad spectrum sunscreen since UV rays are a well known trigger for melasma and can make hyperpigmented patches even more darker. Wearing sunscreen can help prevent melasma from flaring up and hyperpigmentation from getting worse. The sunscreen should have SPF rating of 30 or above with a high UV rating. The higher the SPF rating, the more effective the sunscreen will be in protecting your skin from the sun. Now let's look at some of the topical medications that are used in the treatment of the melasma. For patients with mild melasma, doctors suggest using skin lightening creams as first line therapy. Skin lightening agents can be basically divided into two main two types: those that contain hydroquinone and those who do not contain hydroquinone. Hydroquinone 4% cream can be applied to the affected areas once or twice daily for 2 to 4 months and can be extended up to 6 months. Hydroquinone works by inhibiting an enzyme that is required in synthesis of melanin. Non-hydroquinone skin lighteners include azelaic acid, kojic acid, and niacinamide. They can be used alone or in combination with hydroquinone as first alternative line therapy. The treatment of melasma, the second line treatment is used, which includes chemical peels. In this procedure, we use products such as glycolic acid, salicylic acid, and trichloroacetic acid. Chemical peels can improve melasma by improving the outermost cells of the skin that contain the pigment. Glycolic acid peel is done in dermatologist's office and it is a quick and effective way to rejuvenate the skin. Dermatologists use 20 to 30% concentration of glycolic acid and it stays on your skin for only 2 to 3 minutes, after which it is washed away. Chemical peels should be performed by an experienced practitioner only. Now let's understand what is the homeopathic approach for treatment of melasma. So homeopathy has safe and effective remedies for treating melasma. It helps to restore the normal skin tone and control further progression of pigmentation. So very first drug of choice is best medicine for facial pigmentation is sepia. The skin may be rough or hard, suitable in women during pregnancy, pigmentation arising after childbirth, facial pigmentation during menopause. So next is Berberis aquifolium is highly effective for pigmentation, spots and scars on the face left behind by any kind of eruption. Cheeks may feel hot. Sulfur is another drug of choice for facial pigmentation with dry skin, looks unhealthy and dirty. Person complains of itching and burning sensation of the face. Itching gets worse during heat. These are the few homeopathic medicines which are very effective in treating the melasma. However, the correct choice and remedy is and the treatment is decided after thorough case taking of the patient. Thus, homeopathic remedies of pigmentation are tailor made and should be taken after consulting a specialized homeopath. So that's all for today. And if you are too stressed about your melasma, do remember beauty lies in the eyes of the beholder, not in the color of your skin. Thank you and hope you like this video. Do like, share and subscribe my channel for more updates.